Hello, my name is Danuta Wasserman and I am president of the World Psychiatric Association. Today we celebrate globally Mental Health Day. Why do we need to celebrate this day? It is very important because this day reminds us, but also politicians and decision makers, that we need to have more resources to have open conversations about mental illnesses, to advocate for better treatment and care, and by those conversations and discussions, we will reduce the stigma which very often is associated with mental health disorders. What is mental health? There are many definitions, but probably the best one is one produced by the World Health Organization. And this definition says that mental health is a state of mental well-being which enables us to cope with the stresses of everyday life, to realize our abilities, to learn well, to work well, and to contribute to the family and community. Global burden of mental disorders is huge. And mental disorders, with depressive disorders alone as the second leading cause of global years lived with disability, costs a lot of economical resources due to the lost productivity and lack of mental well-being. Global prevalence and burden of mental disorders is also high among adolescents. More than 248 million young people and young adults live with a mental disorder. Anxiety disorders, depressive disorders being on the top. There is a huge gap still between the needs for treatment and treatment. Why it is so? We know that demand for services in all countries, both high income and low and middle income countries, is huge. But due to the lack of economical resources, in the low income countries, we have limited mental health infrastructure, we have few specialized facilities and less professionals to meet the needs of the population. The situation is better in high-income countries, but all of us know that the resources are still not sufficient. We know also that we have thousands of investigations and millions of invested funds in research, but still the mental disorders are not sufficiently treated due to the lack of available treatments, but also due to the lack of implementation of the knowledge we have about efficacy of our treatments into clinical practice. To achieve further progress, besides increased economic resources, we really need to work for a paradigm shift. It means to have structural instruments to implement our research findings, both in the clinical practice, but also in public mental health. We need to focus on promotion of healthy lifestyles in addition to existing treatments, as there is evidence now that healthy lifestyles contribute to maintenance, but also prevent mental health illnesses and problems. We need also to focus on early prevention and to use preventive methods in working places and in schools. During my presidency until 2026, I, together with my planning group, constructed an action plan for the World Psychiatric Association, in which we will try to increase knowledge, decrease stigma, both in general population, psychiatric patients and the families, but also eagerly to promote healthy lifestyles, especially physical activity, sleep hygiene, nutrition. Other healthy lifestyles, which are also important, like access to green space, intellectual stimuli, and work with prevention in working places and educational settings, will be performed by our many and very skillful scientific sections. Thank you very much for giving me the opportunity to greet you during this very important day. Thank you.